Hi, and welcome back to Hey Doc, What's Up? We've been doing this nice little series about migraines, most people having no real realization that a migraine isn't just a migraine. There are many different facets of migraine. There are atypical migraine, there are ocular migraine. We talked about hormonal migraine, both in women and in men, with women's migraines being primarily premenstrual due to drop in hormone, particularly progesterone. And that treatment with progesterone can be extremely helpful. But there are many other reasons why migraine may actually happen. One of the bigger reasons, which is very little known, is actually a condition you wouldn't necessarily think of even attaching to a migraine, and that's TMJ. Most of us think of TMJ as, oh, okay, I get a little soreness in my jaw, I can't chew gum, I can't open my mouth very much because it may lock and it may click when I sleep. But really, what TMJ is an imbalance of your jaw. And many times this joint up here, if you open and close your mouth, you will feel whether or not you're staying in joint as you open, or whether you may have your joint roll out, and therefore it may roll out and stay out. It may roll back in, which is your click, but you may actually have issues with your upper lower jaw that you may not be set this way, you may be set this way. You may have had a tooth pulled, or you may have had an issue with molars, that you've got some uppers there but not the lowers, and that changes the orientation of upper versus lower jaw. That translates to when you chew, when you speak, when you set your jaw, when you're angry, when you sleep. You may actually snore differently because of an imbalance in your jaw. So know that that muscular imbalance is going to follow the jaw imbalance, because differential use of muscles to pull that jaw back into balance are going to show up as overuse of some muscles over others. If you pull too hard on some muscles, you may actually mimic and or cause a headache, which can then therefore have a prodrome or act like a typical migraine. You may have no prodrome, but you may simply have a headache that won't quit, or what many people will call an atypical migraine. Again, it may be something as simple as your TMJ joint causing this imbalance, which is a chronic problem, therefore a chronic headache. So there's other causes as well. So stay tuned next time for Hey Doc, What's Up?